You probably think that starting your morning with a slice of fresh, sweet papaya is one of the healthiest things you can do. And most days, it is. Papaya is packed with vitamin C, beta-carotene, digestive enzymes, and antioxidants. It's one of nature's tropical superfoods, celebrated in over 100 million households every single day. But what if I told you that the way most people eat papaya could actually put their health at serious risk? That the seeds you're throwing away might be more powerful than you think? That the skin you forget to wash could be silently carrying harmful bacteria into your body? Or that eating too much papaya might do more harm than good? According to a 2023 study in the Journal of Food Safety, improperly handled tropical fruits like papaya were among the top culprits in foodborne illnesses due to pesticide residues, microbial contamination, and hidden enzyme sensitivities. And today, we're going to uncover 7 deadly mistakes people make when eating papaya. Mistakes that could lead to digestive problems, allergic reactions, fertility concerns, and even dangerous bacterial infections if ignored. And if you think you're doing everything right, wait until you hear mistake number 2. It surprises even the healthiest eaters. But before we dive in, take a second to hit the like button, not just for the algorithm, but to help more seniors out there discover these simple, science-backed tips to stay safe and healthy. Tell us in the comments, how often do you eat papaya, and what country are you watching from? We'd love to hear from you. And if you're serious about aging with strength, energy, and clarity, don't forget to subscribe and turn on notifications. Here at It's Better Health, we bring you honest, practical, and research-backed health advice. No fear, no fluff, just facts that help you thrive. Now, let's uncover the 7 mistakes that could turn this tropical treasure into a health hazard and how to avoid them. Mistake number 1. Ignoring a hidden allergy to papain. Papaya is often praised for its soothing effect on digestion, and much of that benefit comes from a powerful enzyme called papain, nature's own protein-dissolving compound. It's why many people eat papaya after a heavy meal, and why papain is even used in some meat tenderizers and digestive supplements. But here's what most people don't know. For a small, but significant, portion of the population, papain can trigger allergic reactions, some of which may be life-threatening. Yes, you heard that right. What's healing to many could be harmful to you if your body is sensitive to this enzyme. A study published in the Journal of Allergy documented a wide range of symptoms in people reacting to papaya or papain. These included itchy mouth or throat, swelling of the lips, face, or tongue, abdominal pain, nausea, or vomiting, skin rashes or hives, and in rare cases, anaphylaxis, a severe allergic reaction that causes breathing difficulties, a sudden drop in blood pressure, and can even result in loss of consciousness. It's a medical emergency that requires immediate intervention. But here's where it gets even more concerning. People with latex allergies are at a much higher risk of reacting to papaya. This is due to something called latex fruit syndrome, a cross-reaction that happens because the proteins in papaya are structurally similar to those in natural rubber latex. So, if you've ever had a reaction to latex gloves, balloons, or rubber bands, you might want to be especially cautious before digging into that bowl of tropical fruit. Let's imagine a scenario. You enjoy a fresh papaya smoothie for breakfast. Later that day, you notice a tingling sensation in your mouth, or maybe a tight feeling in your throat. You brush it off, thinking it's nothing. But the next time it happens, it escalates. Don't ignore it. Even mild allergic reactions can worsen over time with repeated exposure. If you've ever experienced these symptoms after eating papaya, stop immediately and speak to a medical professional. An allergist can perform simple tests, such as skin prick or blood EGA testing, to confirm if papain is the culprit. And for those who are confirmed allergic, doctors may recommend carrying an epinephrine auto-injector, EpiPen, in case of emergency, especially if you're at risk of severe reactions. The bottom line: for most people, papaya is a delicious and healing fruit. But if your body shows signs of intolerance or allergy, take it seriously. What seems like a minor reaction today could become a serious health risk tomorrow. Listen to your body. Respect its signals. Mistake number 2: mixing papaya with certain medications. You eat healthy. You take your medications on time. You drink papaya juice or add the fruit to your breakfast bowl, thinking it's a smart move for digestion and immunity. But here's what most people don't realize. Even the healthiest foods can interfere with your medications, and papaya is no exception. Let's start with one of the most common and dangerous interactions. If you're taking blood thinners like warfarin, Coumadin, or other anticoagulants, you need to be especially careful. Why? Because papaya contains vitamin K, a nutrient involved in blood clotting. Eating large amounts of papaya, especially over multiple days, can disrupt the stability of your medication. According to a clinical study published in the Journal of Clinical Pharmacology, even small fluctuations in vitamin K intake can throw off your medication's effectiveness. If your blood gets too thin, you're at risk for internal bleeding. If it gets too thick, you could develop dangerous blood clots. But that's not all. Papaya is rich in papain, the same digestive enzyme we discussed earlier. While it helps break down proteins, it can also enhance the potency of certain medications, especially anti-inflammatory drugs and anticoagulants, making them too strong for your system. This could lead to easy bruising, nosebleeds, gum bleeding, gastrointestinal irritation, prolonged bleeding after minor cuts. And it doesn't stop there. Papaya also has a mild laxative effect, especially when eaten in large quantities or on an empty stomach. This speeds up digestion, which might reduce the absorption of certain medications if you take them too soon after eating papaya. That means your body may not fully absorb the dose, lowering its effectiveness without you realizing it. For people managing chronic conditions like high blood pressure, diabetes, heart disease, arthritis, these small interferences can accumulate over time, leading to uncontrolled symptoms, drug imbalances, and unnecessary health risks. So what should you do? If you're on any prescription medications, especially those related to blood, heart, or inflammation, don't cut papaya out entirely, but talk to your doctor or pharmacist. Ask whether papaya or papain can interfere with your treatment. Keep your intake moderate and consistent. Avoid eating large amounts of papaya right before or after taking medication. And report any unusual symptoms like bleeding, bruising, or digestive upset. The bottom line: papaya may be natural, but nature is powerful. Even healthy foods can have consequences when mixed with medications. When in doubt, check with your healthcare provider and always eat with awareness. Because health isn't just about what you eat. It's about how it interacts with your body. Mistake number 3: overeating papaya when healthy becomes harmful. We've all heard the saying, too much of a good thing can still be bad. And with papaya, this couldn't be more true. Papaya is often celebrated as a superfruit, rich in vitamin C, vitamin A, folate, fiber, and digestive enzymes like papain. It's a fantastic support for digestion, inflammation, and even immune function. But when you overdo it, your gut will let you know. Let's start with one of papaya's biggest strengths: fiber. Yes, fiber is essential. It regulates your digestion, supports heart health, and even helps lower cholesterol. But suddenly jumping from low fiber to high fiber, like eating 2 or 3 cups of papaya a day, can overwhelm your digestive system. You may experience diarrhea, bloating, stomach cramps, flatulence or gas, general digestive discomfort. And it doesn't stop there. Papain, the enzyme in papaya that aids protein breakdown, is helpful in moderation. But too much papain can stimulate your stomach too aggressively, leading to acid reflux, heartburn, mild gastric irritation, nausea, especially in sensitive stomachs. A review published in the journal Nutrients confirmed that excessive enzyme and fiber intake can disrupt the natural gut flora, leading to imbalance rather than improvement. And then there's the skin effect most people don't expect. Papaya is high in beta-carotene, the natural pigment that gives it that beautiful orange glow. But if you overeat it regularly, this pigment can build up in your bloodstream, causing a condition called carotenemia. You might notice your palms, soles, or even your face taking on a yellowish-orange tint. It's not dangerous, and it's reversible, but it's unsettling if you're not expecting it. And here's the bigger issue. Some people believe that more papaya means more protection from indigestion, inflammation, or even cancer. But no single food is a miracle cure. In fact, excessive reliance on one food can crowd out other essential nutrients and may delay proper medical care. So what's the right amount? According to most nutrition experts, one medium slice of papaya per day, roughly 1 cup of diced fruit, is plenty to unlock its benefits without triggering unwanted side effects. More importantly, listen to your body. If you notice stomach discomfort, loose stools, or any unusual symptoms, cut back immediately. And remember, healing comes from balance, not from extremes. The bottom line: papaya is a powerful fruit, but its strength lies in its balance. Overeating it can cause gut distress, skin discoloration, and false expectations. Enjoy it wisely. Respect its potency. Because when it comes to your health, more is not always better. Mistake number 4. Eating papaya that's too unripe, a hidden risk for your gut, and more. At first glance, a firm, green papaya might seem fresh, crisp, and ready to eat, especially if you're used to tossing it into salads or slicing it up for a quick snack. But here's the surprising truth. Eating papaya before it's ripe enough can do more harm than good, especially for your digestive system, and in some cases, even your pregnancy. Let's break this down. Unripe papaya contains higher concentrations of papain, the same enzyme that helps digest proteins and tenderize meats. In small amounts, this enzyme is helpful, but when it's too concentrated, like in unripe fruit, it can irritate the stomach lining, triggering symptoms like nausea, acid reflux, abdominal cramps, diarrhea. According to research published in the International Journal of Food Science, the enzyme profile in green papaya is more aggressive and harder for the digestive tract to handle, especially in people with sensitive stomachs or underlying conditions like gastritis. But the risks go beyond discomfort. Unripe papaya also contains a milky white latex, a sticky sap that can trigger uterine contractions. For pregnant women, especially in the first trimester, this is a serious concern. The American Journal of Obstetrics and Gynecology warns that consuming raw green papaya may increase the risk of miscarriage or premature labor. That's why in many traditional cultures, from India to Southeast Asia, pregnant women are explicitly advised to avoid unripe papaya, particularly in raw form. So how do you know when papaya is safe to eat? Look for these 3 signs of ripeness. Color: the skin should turn from green to golden yellow or light orange. Texture: a ripe papaya gives slightly under gentle pressure. Smell: a subtle tropical, sweet aroma should be noticeable. Inside, the flesh should be vibrant in color, soft, and scoopable with a spoon. If it's still pale, hard, and odorless, it's not ready. In some Southeast Asian dishes, like Thai green papaya salad, unripe papaya is used, but it's always shredded, cooked, pickled, or marinated to soften the enzymes. Never eaten raw in chunks. The bottom line: unripe papaya may look tempting, but it can irritate your stomach and, for pregnant women, even pose serious risks. Always wait until it's ripe, soft, sweet, and fragrant before taking that first bite. Because in the case of papaya, patience isn't just a virtue, it's a safety measure. Mistake number 5. Throwing away papaya seeds, wasting nature's tiny superfood. Every time you slice open a papaya, what's the first thing you do? Scoop out those glossy black seeds and toss them straight into the trash? If that's been your routine, you've unknowingly been discarding one of the most underrated health powerhouses sitting right in your fruit bowl. Let's break this myth wide open. Papaya seeds aren't just edible, they're medicinal. Inside these tiny beads lie a potent combination of healthy fats, great for brain and heart support; plant-based protein, for muscle and cellular repair; gut-friendly fiber, that promotes digestion and regularity; key minerals, including magnesium, calcium, and phosphorus. But beyond their nutritional basics, it's their therapeutic power that truly shines. Gut health and antibacterial strength. A groundbreaking 2013 study in the Journal of Medicinal Food found that papaya seed extract possesses strong antibacterial and antiparasitic effects. It was shown to fight against dangerous bacteria like E. coli, Salmonella, Staphylococcus aureus, which means that just a small dose of these seeds may help naturally cleanse your digestive tract, support your immune defenses, and reduce the risk of foodborne infections, especially useful for older adults with sensitive systems. Enzyme support for digestion. Just like the fruit's flesh, papaya seeds contain papain, the digestive enzyme that breaks down proteins and soothes the stomach. For those who struggle with indigestion, bloating, slow metabolism, a small amount of papaya seed can offer natural support, improving nutrient absorption and reducing that sluggish post-meal heaviness. And with their peppery, sharp flavor, you can even use them creatively. Add crushed seeds to smoothies. Sprinkle over salads. Use as a spicy alternative to black pepper. They're functional and flavorful, all in one. But here's the catch: moderation is key. Like many powerful natural substances, too much of a good thing can backfire. Papaya seeds also contain potent compounds like benzyl isothiocyanate, carpane. In excess, these can stress the liver and kidneys. Animal studies have even shown that very high intake may reduce fertility, so this is especially important for individuals who are trying to conceive. So how much is safe? For healthy adults, about 1 teaspoon of raw papaya seeds per day is considered safe and beneficial. You can chew them whole, crush them with a spoon, or blend them into your favorite dish. If you're pregnant, nursing, managing kidney or liver issues, or giving papaya seeds to children, always consult a healthcare provider first. The bottom line: stop tossing out what your body might need most. You've been throwing away something powerful, and now you know better. Papaya seeds are tiny, but mighty, packed with antibacterial power, digestive support, and key nutrients that your body craves, especially as you age. So the next time you enjoy a papaya, pause before you scoop and toss. Instead, scoop and save. Because sometimes, the most powerful medicine hides in the parts we overlook. Mistake number 6. Storing papaya the wrong way, turning a healing fruit into a health hazard. Papaya may be packed with vitamins, enzymes, and healing potential, but if you store it the wrong way, all those benefits can disappear, or worse, turn dangerous. Let's be honest. Most of us come home from the market, toss the papaya on the kitchen counter, or maybe forget it in the fridge for a week. But this tropical fruit is far more delicate than we give it credit for. And improper storage? It can lead to spoilage, bacterial growth, and nutrient loss faster than you think. Why papaya spoils quickly? Papaya is made up of about 88% water and contains natural sugars, both of which create a perfect environment for bacteria to thrive if not stored properly. According to food safety guidelines from the United States Department of Agriculture, USDA, papayas are considered high-risk perishables, especially once they're ripe or sliced. Let's break it down. If your papaya is unripe, keep it at room temperature, away from direct sunlight. Let it ripen naturally. You'll know it's ready when the skin turns golden yellow or orange. It gives slightly under gentle pressure. A sweet aroma develops. Don't refrigerate unripe papaya. The cold slows ripening and dulls the flavor. If your papaya is ripe, once ripe, the countdown begins. Move it to the refrigerator immediately. Whole ripe papayas last about 5 to 7 days in the fridge. Store them in the crisper drawer if possible to keep moisture and temperature steady. If your papaya is cut or sliced, this is where most people make the biggest mistake. Many leave it out on the counter thinking, "I'll eat it later today." But papaya flesh should never be left at room temperature for more than 2 hours. Why? Because bacteria like Salmonella and Listeria can multiply rapidly, especially in warm or humid kitchens. The CDC, Centers for Disease Control and Prevention, warns that sliced tropical fruits left unrefrigerated become unsafe shockingly fast, especially for seniors, children, pregnant women, people with weakened immune systems. How to store it right and keep it powerful. Use an airtight container. Prevent oxidation and cross-contamination. Refrigerate immediately, ideally within 1 hour after slicing. Consume within 2 to 3 days. After that, nutritional value drops and bacterial risk rises. Keep away from strong odors. Papaya easily absorbs nearby smells, ruining flavor and freshness. Never store in direct sunlight or near ovens. Heat speeds up spoilage. Pro tip: when storing half a papaya, leave the seeds intact if possible. They help slow the degradation of the flesh by reducing oxidation. The bigger picture: improper storage might seem like a small slip-up, but over time, repeated exposure to spoiled or bacteria-laden fruit can cause digestive issues, foodborne illness, loss of nutrients your aging body needs. And for vulnerable seniors, just one round of Listeria or Salmonella can mean hospitalization or worse. The bottom line: handle papaya like medicine because it is. Treat your papaya with the same care you'd give a prescription supplement. Because when stored right, it delivers enzymes, antioxidants, and vitamins that keep your gut clean, your skin glowing, and your energy levels strong. But when stored wrong, it becomes a breeding ground for bacteria and a missed opportunity for healing. Your fruit deserves better, and so do you. Mistake number 7: not washing the skin before cutting. A silent doorway to dangerous bacteria. You bring home a golden, ripe papaya. It looks clean, smells fresh. You're excited for that juicy sweetness. So you place it on the counter, grab a knife, slice it open, and dig in. But here's the critical mistake almost everyone makes. You never wash the skin. And that one overlooked step? It might just be how bacteria, pesticides, and even traces of animal waste sneak directly into your fruit and into your body. The dirty truth about unwashed fruit skins. According to a 2017 report by the Centers for Disease Control and Prevention, CDC, multiple outbreaks of Salmonella in the U.S. were directly traced back to papayas contaminated on the outside. The problem wasn't the fruit itself, it was the handling. What happened? When people sliced into unwashed papayas, their knives acted like a shuttle, dragging pathogens from the peel straight into the flesh. Those pathogens included Salmonella, causes fever, cramps, diarrhea. Listeria, particularly dangerous for the elderly, pregnant women, and those with weak immunity. E. coli, linked to food poisoning, severe dehydration, and kidney damage. And remember, papayas often travel long distances before they reach your kitchen. Along the way, they can pick up dirt and dust, pesticide residues, bacteria from handling, packaging, or transportation, even animal droppings during harvesting. Pesticides, the invisible enemy. Papayas are often treated with chemical sprays to protect them from pests and mold. While effective in farming, those residues linger on the skin and can be transferred inside when you cut through them. Over time, chronic exposure to even small amounts of pesticides has been linked to hormonal disruption, respiratory irritation, allergic reactions, and in some cases, increased cancer risk. Especially in seniors, whose detoxification systems may be slower and more fragile, this exposure becomes more dangerous than we think. So what should you do instead? It's simple, but powerful. Always rinse your papaya thoroughly under running water. Use your hands or a soft produce brush to gently scrub the skin. No need for soap. Clean water and friction are enough to remove most surface contaminants. After washing, dry with a clean towel to avoid recontamination. Then, and only then, grab your knife. You wouldn't eat food off a dirty plate, so don't cut into fruit with an unwashed skin. A small step that protects so much more. When we're hungry or in a rush, washing the outside of fruit might feel unnecessary, especially when we're not planning to eat the peel. But it's not about the peel. It's about what's riding on it and where that ends up, especially for seniors with lowered immunity, expecting mothers, kids, or anyone recovering from illness. That quick shortcut can come at a much bigger cost. The bottom line, wash before you slice, always. Papaya is a healing gift from nature, full of enzymes, antioxidants, and nutrients. But only when you treat it right. So the next time you reach for that vibrant fruit, take just 1 minute to wash its skin first. It's not about being paranoid. It's about being prepared. Because in health, it's the small choices, the ones we almost skip, that often protect us the most. Conclusion: a sweet fruit, a smarter choice. Papaya isn't just a tropical treat, it's a natural healer. Packed with vitamin C, enzymes like papain, antioxidants, and fiber, it can soothe your digestion, nourish your skin, and even support heart health. But like any superfood, how you eat it matters just as much as why. Let's quickly recap the 7 deadly mistakes to avoid when enjoying papaya. Ignoring papain allergies, especially if you're allergic to latex. Mixing with medications, like blood thinners, without medical guidance. Overeating, which can trigger gut distress or skin discoloration. Eating it too unripe, which can irritate the stomach and even be risky during pregnancy. Throwing away the seeds, missing out on their antibacterial and digestive power. Storing it the wrong way, letting bacteria or spoilage take over. Not washing the skin, a simple step that could prevent foodborne illness. Each mistake may seem small, but over time, they can silently chip away at your health, energy, and resilience, especially as you age. But here's the good news. Now you know better. And with that knowledge, every bite of papaya becomes more powerful, more nourishing, and more protective. So the next time you slice into that vibrant orange fruit, take a moment. Wash it, store it right, eat it ripe, and eat it with intention. Your future self will thank you. Before you go, before you head off to your kitchen, take a second to hit the like button. Not just for the algorithm, but to help more seniors discover simple, science-backed health tips that truly make a difference. Drop us a comment. How often do you eat papaya? And did any of these mistakes surprise you? And if you're serious about aging with strength, clarity, and confidence, make sure to subscribe to It's Better Health and turn on notifications. We're here to guide you with real facts, real habits, and zero fear-mongering. Until next time, eat smart, live strong, and remember, the small choices build a better you.